In this column here, we see that each room has specific number of beds. In our first VIP room here, the room has 10 beds, same to the second, same to the third, and the regular rooms, each room has 30 number of beds, and the normal rooms have 60 number of beds. Their prices are also indicated here according to the standard of the living, according to the living standard of the patient, as well as the room status are indicated here. All the rooms are active. From there, we go to our next sheet. That is the sheet of drugs used by the patients. Each and every patient who comes to our clinic, they have different diseases, and each disease is treated by administering the appropriate drug or medicine to the patient so that the patient can get well or be healed. Now, as listed below, each and every patient in our clinic here, they have different diseases listed as follows, as well as their disease status, and also the drugs administered unto them. Our next sheet is the patient duration sheet. In this sheet, we are going to see the number of days the patient spent in our hospital. We have their names here. We have the dates in which they were admitted into our clinic, as well as the dates they were discharged. To get the days spent, you just subtract the date they were discharged from the dates in which they were admitted. We go to our last sheet, that is the payment sheet. Now, in this sheet, we will look at this column of, we will look at this column of the room type price. Now, in this room type price, as we saw earlier in the room information sheet, the rooms are based on the living standards of the patients. That is, if the person is a VIP, the person should pay a price of 5,000 Kenya shillings. If the person is in a regular standard, he or she should pay a price of 3,000 Kenya shillings. And if the person is in a normal living standard, he or she should pay a price of 500 Kenya shillings. We go to our next column, column number S, the registration fee. As we saw earlier, the registration fee should be paid by each and every patient who comes to our hospital, so that he may be treated, or he may be offered the services available in our hospital. So for the patient to be registered, he or she must pay a price of 200 Kenyan shillings. From there, we go to our next column, number T. That is the column on the prescription fee. Now, in this column, the prescription fee is based on the sheet that we had here, the sheet on rating. In our sheet here, it means that if the prescription in our case here, we mean that if the patient, if the drugs administered to this patient, if the drug was administered 1 to 2 times by the doctor, then